Praise God. But my guests tonight are individuals with the Volusia County Health Department. We have the director, who is Dr. Bonnie Sorensen, and the deputy director, Dr. Celeste, Phillip, and an intern, Ethan. Praise God. So we got all of them that are here tonight, and I believe that Dr. Sorensen wanted to start out and just share some things with you guys, and then they've decided kind of how they're going to round robin this, and then I will interject something from here, you know, if there's a need. You guys know I can't keep my mouth shut. Anyway, but praise God. But we are going to hear as much as we can from them about these two projects and how it will, that information will impact that area. And you know, when that area is impacted, the 32114 and the other areas that they will be talking about, then that will impact the community, and then the community overall will impact the county. Because you can't change, you know, one part of even one family without there being an impact that changes other parts of what that family impacts. So I want to start then with the director for the Volusia County Health Department, Bonnie Sorensen.
Thank you so much, Gwen. Thanks for inviting us. We're very pleased to be here as a group to talk about these particular projects. In actuality, what stimulated these projects was really the county health rankings. The county health rankings are a snapshot of the county's health that are put online every year. And this 2011 snapshot and the 2010 snapshot were the first 2 years that these health snapshots were placed online. And what's interesting about these county health ranking snapshots is that it not only displayed the overall health of the community, but it also shared with us the factors that contribute to our health. So overall, Volusia County ranked 35 out of 67 counties. We were right in the middle, average health. I actually think it's rather mediocre considering what we think our community should be. So overall, our health ranking amongst 67 counties in Florida was really just in the middle. But when we looked at the factors that contribute to health, it became very interesting. Most of us think that healthcare causes health. And the reality is, healthcare really is disease care. Folks don't access their healthcare system until they have a disease, till they need help. They're sick and they need to be made well. Whereas health is much greater than healthcare. And in fact, the healthcare system only contributes 20% to our health, whereas behavior, personal kind of behaviors that we choose, whether it's alcohol use or tobacco use or sexual risky sexual behavior or use of bicycle helmets or seat belts, etc., contribute 30% to our health. What's interesting is that 40% of our health is determined by socioeconomic conditions, kind of where we live. And what our county health ranking showed was that our healthcare system ranked 9 out of 67. We have a very robust healthcare system. We've got 7 hospitals, including a level 2 trauma center. We have a medical school, a family practice residency program. We have 3 nursing programs. We have hospital taxi. We have very robust healthcare in our community, and yet our health status snapshot is mediocre. And when we looked at the socioeconomic factors, that factor that contributes to our health, 40% of our health, turned out we were 46 out of 67 counties in Florida. We were very low in the impact of socioeconomic factors on the health of our citizens. The reality is we have haves and have-nots in Volusia County, and a great gap between the haves and the have-nots. So when we saw these county health rankings, we said, gee, we're all about the health status of our community, but what's happening is there are pockets in our community that have disproportionate health, have poor health status, much poorer than other areas of our community. And we identified right away some of the stats that you've already talked about, the infant mortality rate, the incidence of preterm labor, is disproportionate. HIV is disproportionate in this community. Diabetes is just, all the health status indicators are adversely impacting this community, Daytona Beach, and particularly the 32114 zip code, much more than other areas of our community. So that's what spurred us to look at what can we do to help this Daytona Beach community, and particularly the zip code of 32114. So we applied for a couple grants, and we received both of those grants sort of simultaneously. The Achieve grant is sort of a top-down look at the community, whereas the PACE grant is sort of a bottoms-up look at the community. And that's what we're here really to chat about. So I'll be happy to turn it over to my colleagues here who know many more of the details of what's going on and what results we have found.
Okay, wonderful. Dr. Celeste, Phillip?
Well, we can start talking about Achieve, and I have to confess, these acronyms are quite long, and I can never remember them, so I have a little cheat sheet here. Achieve stands for Action Communities for Health, Innovation, and Environmental Change. And this is a program that's being sponsored by several national agencies that are encouraging cities or communities that do have these pockets of poor health outcomes or health inequities to take a comprehensive look at what's going on in the community, do some assessments with a team that you pull together from different members, and policymakers, quite important, because those are the folks that can actually affect change based on what your findings are. So back in June, our team, and I want to mention that Teresa Moran, who's our Health Promotions Director at the Health Department, and Dr. Alma Dixon, who is the Director of the Within Cookman Wellness Center, are the two co-chairs, and so we brought together the team to go to this training in Baltimore, and we learned from some of the other projects throughout the country. This year there were 40 communities throughout the country that were awarded, so this really is something that is exciting and able to make a difference. And you mentioned starting in smaller pieces. Well, when you have multiple different groups doing different things, that's how you have the larger change. So we're quite excited to be a part of that. So what we've done so far is look at different community organizations, universities, some of the schools, to see what is going on within our environment for supporting good nutrition and physical activity, as well as limiting exposure to tobacco. And through that process, we found pretty consistently that everyone has recognized nutrition is one of the biggest gaps in this community because there's not a lot of access to fresh fruits and vegetables. This community is actually deemed a food desert, and I think I may have talked about this a little bit before, but a food desert is an area primarily low-income families. They tend to be minority families that do not have access to a grocery store within a 1 mile radius from where they live. And the reason that's important is because research has shown very consistently that the further away you live from being able to access fresh or healthy foods easily, the less likely you are to consume those items. And when we talk about the 30% that affects our health, that's a pretty major problem if you don't have access. On top of that, there is an issue of the quality, the prices. So there are a lot of different things to address in order to increase access to healthy fruits and vegetables. But that was one of the major themes that came up. In addition, there are different initiatives that we're looking at for promoting physical activity. And some of those center around safety issues. So, for example, do you have sidewalks that are continuous, that are in good condition, that don't have cracks or trees or other items overhanging into them? Especially when you think about families with young children, or maybe somebody with a disability who has to use some kind of device with wheels. We walked the neighborhood and noticed that if you had some kind of assistive device that required wheels, it'd be quite difficult to get around because you're having to go into the street, and then the streets are narrow, and then you're walking in traffic. So some of those basic things we noticed being barriers for people who want to go out and exercise or want to go out just to run an errand, that those kinds of challenges are quite common and make it more difficult to be active. So those are just a couple of things that we noted from that assessment and are looking to be able to address through different manners.
Now, Ethan is an intern with Volusia County Health Department, right?
Yes, ma'am.
Yes, ma'am. Okay, and looking all sharp with his glasses and all. But as an intern, you've been involved in these programs, and we wanted to start off asking you because Dr. Bonnie was saying that you were kind of new to the area, so you had the opportunity of looking with some fresh eyes. Right?
Oh, well, I'm new to the PACH project, but
Okay.
I'm actually from the area.
Oh, wonderful.
Yeah.
Okay, so then you can look then with fresh eyes, but old eyes also in terms of what you've seen in the past and what you would envision with really given information that you guys are starting to actually obtain. What would you envision as something that can help the situation in those areas?
Well, I mostly work with PACH, and I know we haven't really talked about that yet.
Well,
But,
tell us about it.
well, PACH stands for Protocol for Assessing Community Excellence in Environmental Health, another long acronym. And pretty much like Dr. Sorensen was saying, it's a bottom-up approach. In August and the beginning of September, we conducted community assessments, and pretty much the boundary only includes Central City, Daytona, and Midtown, and it also extends a little out to White Street. So it's a smaller area. It's not the entire 32114 area code. It's more concentrated, and about, I believe, around 305 assessments were completed in the area. And after that, it was determined that the top 5 issues by the community were unemployment, crime and drugs, flooding, access to health care, and meeting basic needs. Yeah, that's fine. And so now we're at a stage, we've formed, we've had a steering committee, I believe, since June. And right now we had our steering committee meeting at the end of September. And with the steering committee is basically made up of people from the community or people who have some type of influence in the community, pastors, school principal, business owners, just residents, you know. And they come together, and they came together at the end of September, and we presented these findings back to them. And we're at a phase now where we're trying to prioritize these issues, basically looking at the feasibility, the timeliness, the impact that addressing each issue would have, and which issue would be, I guess, the most valuable to attack. So we have like a priority setting exercise that they've completed, and we're also in the phase of doing focus groups in the community, and this will be everywhere, all throughout the community is really what we're trying to do, to get more feedback from the residents, to get to the root causes of, you know, what exactly is unemployment, because unemployment is this huge kind of grandiose issue.
Right.
So, you know, why is it, you know, why is unemployment such a huge problem? Is it the lack of training, you know, lack of education? Is that where exactly do we start here? And same with all the other issues. So right now we're at a really good place because we really have been able to hear, you know, the voice of the community and what their concerns are. Now it's just really trying to have the patience of continuing to dig deeper, like what exactly are these issues, so we can better address them, and also prioritize. Say what is the top priority, you know, and right now with the priority exercises that are coming back and talking to some more people in the community, really what's coming out is that meeting basic needs is the overall, and that's a very generalized term, but which is what we're getting into. But a lot of times people identify, you know, meeting basic needs as far as being able to afford to feed your family, fresh fruits and vegetables, not just, you know, junk. Being able to have health care, you know, being able to have a roof over your head, in a safe place to live.
Right.
So that's the community's main concern. They feel like, you know, they can't do that. So right now, what we're trying to figure out, you know, is you know, continue to figure out what your basic needs are, and then, you know, why is it that you cannot meet these needs. So